It's Saturday. It is now however many days post-surgery, 12 days post-surgery. So here's some updates. I feel almost human again, which is positive, very positive. I have been able to sleep regularly again for the most part. So 6 or 8 pillows that had been on my bed to prop me up at night are all gone now. I have driven my car once because I had stopped taking pain medications a long time ago. And I think that I'm starting to believe what everybody told me, that on the other side you feel better and things start to look up. Interestingly enough, on Thursday night, I attempted to eat hummus, which is on my list, and I had a horrible reaction to it. Now, this was something I actually enjoyed before the surgery, and I knew to expect that there would be certain foods that I would react to post-surgery, but it was very disappointing. Happily, I didn't throw up from it, but I was damn close. So it was a refrigerated brand, which I had normally eaten prior to surgery, and it did taste different a little bit to me at the same time. And I had been warned that my taste buds would be constantly changing, and I haven't really noticed it a lot, but I did then. So hummus is off the rotation right now. At some point I will revisit it. I've been told that when you have an adverse reaction to something, to stop and do it again at some point. Now the dogs are going to bark, which is normal for my recordings. And so that was my big issue on Thursday night going into Friday. But each of the days since Wednesday morning, I've been waking up feeling way better. Most of my scars are healing pretty well at this point in time. So I don't feel so stretched out in the stomach area or upper abdomen area, which is where all of the holes seem to have been. So that's positive. The one thing that I'm still having issues with is that doing stairs, huge problem. I have no stamina for stairs right now, and I get really, really winded. So I haven't been cleared because of how I'm recovering for any major activity, but my doctor and my family continues to encourage me to start walking. So I have been a little shy on the go on that because I haven't been feeling right. But now that I'm really feeling like a human being again, I'm going to start going for walks. They're going to be short, I'm sure, at first. But starting today, I'm going to go for maybe a walk around the parking lot where I live in the townhouse. So we're going to start doing that. I'm going to start doing that to help promote this healing and this being able to breathe when I'm working out. Positive side, I think I had mentioned at the beginning of the week that I was having a problem breathing when I was having conversations. That was quickly over, so probably it was just a question of re-engaging my diaphragm at a regular basis. I noticed that I have a very big inability to sing right now, probably also related to my diaphragm issues. So, we'll be working on these things as well. So overall, I think maybe I was a little positive this week at some points, but overall, I would say right now, it's definitely looking up. I was able to start taking the vitamins too. This is day 2 of vitamins. So I'm taking the biotin to help my hair, and I started the multivitamins. So I'm going to do those for a couple days, and then I'm going to add the calcium back in. So making strides. My serving sizes of the things that I am able to eat are very small, like very small. I probably mentioned this before, but it's worth mentioning again. I make 1 egg. I barely eat a quarter of it, which is weird, but that's all my body can take right now, and I am listening to my body and trying not to overdo it, because the feeling you get when you overindulge, which is funny to say, overindulging in an egg, is not good. I still have a feeling of, and it's happening right now, little bit of reflux, but for the most part, I'm not taking anything for that. I was prescribed something, but it was something I had been prescribed when I was in my 30s and it didn't work for me. And I kind of decided that I would just like kind of try to go and see what happened. And my doctor said it was fine. So if it gets really bad, I'll have to talk to him about getting something else. But I think it's just, again, getting used to it. Sipping slowly, frustrating. Weird to be frustrated by that, right? But it used to be I could pick up my glass of water and just chug a lug. You can't do that anymore. So my goal for this weekend is to make sure that I do eat all 3 meals, and I use the term meals lightly. But I had my egg this morning. The next thing up on my agenda as I'm drinking water this morning is going to be the protein shake. I'm trying to follow, they gave me a menu, so I'm going to try to follow the menu, at least in terms of what I can and cannot be doing right now. And I'm going to try a couple other things on the list that I was given for soft pureed foods to see how I do with them. I figure the weekend's a good time to experiment. And that's it, really. I weighed myself this morning, or just a few minutes ago. Yeah, it's still morning. And I am down 21.5 pounds since this whole thing started way back on day 1 of the liquid diet. So that's really fascinating to me. And I mean, I get it, but it's still fascinating that the weight is coming off this way. But I guess, you know, when you're barely eating and your stomach is the size of, I don't even know what I can compare it to at this point. So that's where we're going from here. So anyway, this is a really long video. I haven't made one this long in a really long time. But I guess what I'm trying to say is that it is finally true. There is a light at the end of the tunnel. I am feeling better and continuing the journey. Thanks for listening.